Describe the mechanism of action of entacapone to treat Parkinson's disease. 3 marks. COMT inhibitor with opicapone. It inhibits the methylation of levodopa by COMT to 3-OMD as part of the metabolism of levodopa. A higher concentration of 3-OMD forms when peripheral dopa decarboxylase is inhibited, and this competes with levodopa for active transport into the CNS. By inhibiting COMT in the peripheral tissues, this leads to decreased plasma concentrations of 3-OMD and increased plasma concentrations of levodopa available for transport into the CNS. List 4 common adverse effects that might be experienced by a patient taking rivastigmine. What is rivastigmine indicated to treat? 2 marks. Anticholineesterases with donepezil, galantamine GI adverse effects, nausea, vomiting, diarrhea, weight loss, vivid dreas and depression, urinary incontinence, tremor, muscle cramps, dizziness and fainting, fatigue and drowsiness. Switch. One of the following drugs is most effective in the treatment of the motor symptoms associated with Parkinson's disease. Benserazide, entacapone, pramipexole, levodopa. First line, true or false? Dopamine has high bioavailability, therefore levodopa, an amino acid metabolic precursor of dopamine, is used to slow dopamine's crossing of the blood-brain barrier in order to minimize adverse effects. 0.5 marks. False. Dopamine has low bioavailability, so does not readily cross the blood-brain barrier. Therefore, levodopa, an amino acid metabolic precursor of dopamine, is used to replenish dopamine levels. A pharmacy student is asking you to explain why levodopa might be combined with carbidopa in a combination tablet. Explain the function of each component in the treatment of Parkinson's disease. 5 marks. Once L-dopa enters the brain via an L-amino transporter, the enzyme dopa decarboxylase converts it to dopamine, restoring dopaminergic neurotransmission in the striatum, relieving motor symptoms. Carbidopa and benserazide are peripheral dopa decarboxylase inhibitors that do not cross the blood-brain barrier. They diminish the metabolism of levodopa in the GI tract and peripheral tissues, hence increasing the availability of levodopa to the CNS. The combination lowers the dose of levodopa needed by 4-5 folds and decreases the severity of adverse effects arising from peripherally formed dopamine, e.g. nausea, vomiting, and hypotension. Explain the mode of action responsible for impulse control disorders that can occur with the use of pramipexole. 2 marks. Pramipexole is a dopamine D2 agonist, however. It has preferential affinity for dopamine D3 receptors acting at postsynaptic neuron. Bromocriptine asterisk and cabergoline are dopamine D2 receptor agonists, however. They also have some activity at dopamine D3 and D1 receptors with more selectivity at dopamine D2 and D3 than D1 receptors. Rhodigotine is a high-potency dopamine D1, D2, and D3 receptor agonist and has lower potency at dopamine D4 and D5 receptors. Your patient with a history of Parkinson's disease is suffering from vertigo. Which one of the following drugs would be a suitable treatment for vertigo in this patient? Prochlorperazine, beta-histine, levodopa, rivastigmine. 1 marks. A. Prochlorperazine. Some of the common side effects of levodopa/carbidopa or levodopa/benserazide combinations include GI adverse effects. Explain what GI effects patients might experience and why these side effects are thought to occur. 2 marks. Patients might experience anorexia, nausea, vomiting due to excessive levels of dopamine in GI tract and peripheral tissues. Dose-dependent and hypotension in early states of treatment. This question has 4 parts. Rasagiline is indicated in the treatment of what condition? What drug class does rasagiline belong to? Name one other drug in the same drug class. Describe the mechanism of action of rasagiline. 6 marks. Mainly used as an adjunct to levodopa in later PD. Sometimes used as initial monotherapy for PD patients with mild symptoms. Rarely selagiline 2-monoamine oxidase type B inhibitors. Same as safinamide and selagiline. Selagiline MAOB is the predominant isoenzyme responsible for most of the oxidative metabolism of dopamine in the brain. They are an adjunct to levodopa in later PD. To reduce, off. Times selagelene and rasagiline are irreversible inhibitors of MAO-B, and they reduce the breakdown of dopamine, increasing its vesicular stores. Safenamide is a reversible inhibitor of MAO-B and may act in several ways, including blocking dopamine reuptake. Hence, higher levels of dopamine are maintained in the synapse. Why wouldn't a controlled release preparation of levodopa and carbidopa be suitable for the first morning dose for a patient with Parkinson's disease? 1 mark. Controlled release products are not usually suitable for the first morning dose when a fast onset of action is required. Explain why spacing levodopa doses away from dietary protein intake can improve the bioavailability of levodopa. 6 marks. Dietary protein can reduce L-dopa absorption because L-dopa is absorbed through the amino acid transport system, and dietary proteins are broken down into amino acids that can compete for peripheral and central absorption of L-dopa across enterocytes, inhibiting levodopa's entry into the systemic circulation. After entering systemic circulation, levodopa's transport across endothelial cells of blood-brain barrier may also be reduced by competition with amino acids. So spacing levodopa administration away from dietary protein intake may improve levodopa bioavailability. Explain the mode of action of donepezil to assist with Alzheimer's disease symptoms. 3 marks. Donepezil is anticholinesterase with galantamine and rivastigmine, which are reversible antagonists of cholinesterase. Hence, they decrease the breakdown of OCH, which is increased this neurotransmitter in the synapse, to reduce the deficiency of cholinergic neurotransmitter activity observed in explain the mode of action of memantine in the treatment of Alzheimer's disease. Include in your answer why it is reserved for moderate to severe Alzheimer's disease. 4 marks. Memantine is an antagonist of the NMDA-type glutamate receptor. Blocking stimulation of the NMDA receptor may reduce excessive toxic excitatory glutamate levels and neuronal injury. If glutamate continuously activates MNDA receptor, it will lead to neuronal damage and death of the neuron. Memantine is better tolerated than anticholinesterases, but is reserved for moderate to severe AD due to little evidence earlier in the disease. How long does it take for drugs taken for Alzheimer's disease to have a beneficial effect? 9. 18 months, 14 days. 9. 18 months, 3. 6 months. 1 mark. D. 3-6 months. Why should rivastigmine be used with caution in a patient with a history of bradycardia? 1 mark. It may increase risk of bradycardia and hypotension, so use cautiously in patients with a history of bradycardia. Donepezil is an anticholinesterase. Name another anticholinesterase that may be used in the treatment of Alzheimer's disease. 1 mark. Galantamine. Rivastigmine. Which one of the following drugs is most commonly associated with nausea and gastrointestinal upset? A. Levodopa. B. Interferon beta 1b. C. Rivastigmine. D. Memantine. 1 mark. C. Rivastigmine increases level of neurotransmitter acetylcholine, which stimulates the cholinergic receptors in gastrointestinal tract, leading to increase in gastric acid and fluid. Levodopa is commonly combined with carbidopa, that GI side effects can be reduced. True or false? Anticholinesterases reduce the risk of developing Alzheimer's disease and dementia in patients with mild cognitive impairment if therapy is commenced early enough. 0.5 marks. False. It helps improve cognition or reduce cognitive and functional decline, but the amount of benefit is modest and varies. Fill in the blanks. Fingolimod is a drug class, sphingosine 1-phosphate receptor modulators that causes reversible/irreversible downregulation, internalization and destruction of S1P1R on lymphocytes. This stops lymphocytes from leaving lymph nodes, reducing their migration to the CNS, and reduces inflammation and demyelination. 6 marks. Same as ozanimod and siponimod. Why should patients intending to start multiple sclerosis treatment with cladribine have baseline blood counts and liver function tests prior to initiation and regular monitoring during therapy? 2 marks. There is an adverse effect of lymphopenia, neutropenia, leukopenia, low white blood cells, and liver injury due to inhibition of DNA synthesis and repair which deplete B cells and T cells. They should be monitored for white blood cell changes and liver damage. Which one of the sphingosine 1-phosphate receptor, S1PR modulators is a prodrug? One mark fingolimod named the MS treatment that has a risk of the patient developing antibodies to the drug within up to 18 months of commencing therapy. Which drug in this class has the lowest risk of this occurring? 2 marks, interferon beta, 1A and 1B peginterferon beta 1A has much lower risk. Describe the mechanism of action of ocrelizumab in the treatment of multiple sclerosis. 3 marks. Ocrelizumab is humanized monoclonal antibodies binding to a surface protein on B and cell's CD20 antigen. It triggers antibody-dependent cell-mediated cytolysis, ADCC, and complement-dependent cytolysis, CDC, of circulating B cells. Ocrelizumab may also target CD20 antigen on T cells, which are present in low frequencies in MS patients. Afadomumab, fully human MOB binding to CD20 protein on B cells like ocrelizumab and triggers antibody-dependent cell-mediated cytolysis, ADCC, and complement-dependent cytolysis, CDC, of circulating B cells. However, it causes more CDC than ADCC. Progressive multifocal leukoencephalopathy is a serious side effect associated with the use of fumarates that is caused by the reactivation of which asymptomatic childhood virus. What might this condition resemble? 2 marks. It is caused by the reactivation of a common asymptomatic childhood virus known as the John Cunningham, JC virus. Symptoms resemble those of relapsing MS-True or false. Dimethyl fumarate and diramyxyl fumarate are both prodrugs that are metabolized to the same active metabolite, monomethyl fumarate. True. Dimethyl fumarate and diramyxyl fumarate, a new drug, are metabolized to monomethyl fumarate, the active form, so their efficacy and safety are expected to be similar. Only their doses differ. 0. 5 marks. The fumarate's exact mode of action is unknown, however. They may activate a transcription factor, nuclear factor erythroid 2-related factor 2, NRF2, that renders cells resistant to inflammatory damage. NRF2's actions are very complex. In MS, it is believed to have antioxidative, immunomodulatory, and anti-inflammatory effects.